Hi everyone, we're going vlog style today because I am mostly talking about just personal transition update things, which I don't do very often on this channel, but I like to kind of check in. First of all, just kind of like general progress, this is what's going on, but also because I do see and get people that ask questions about social and especially like medical transition when you're like genderqueer, non-binary, and not following a more traditional type of path, or even like, hey, I don't see my body type represented, that kind of thing. So I'm off to a new doctor's office today. Yeah, and then yesterday was my six month post-op mark, so I'm going to talk about that later and show you guys some of that progress. And so I like to do that kind of thing now and then because I think people are curious about it in a like, I want to do that too, how does it work, how does it look, that kind of way. So anyways, I'm off for now and then I will check in with you after. Welcome back, not that you're the ones that went anywhere, but I'm back from the doctor's. I'm also in a weird setup because I'm still just doing vlog style because I'm doing laundry and I need to go do some homework, and I didn't really feel like spending the time to set stuff up, but I also like film this usually on an iPad, which gets shaky after a couple minutes. So here we are. So I'm just going to acknowledge that yes, that's a tank top hanging up in the background like of my bedroom. This says "Suns Out, Guns Out," and it's like an inside joke kind of thing between my friend and I who gave it to me. But I really, like I said in one of my other videos, my goal is to look good in a tank top. So like, I've been doing push-ups, so there is my reminder. And like this part of my arm gives me a ton of dysphoria, so I do, let's be real, I do mostly modified push-ups on my knees because I still don't have the upper body strength to do full-on push-ups. So I do like a couple of those, as many as I can, and then I switch to the modified. But I do like the diamond push-ups, which are supposed to work that, and I do like some weight exercises, and you still see like no tricep definition, and it gives me a lot of dysphoria sometimes, which is one of the reasons I went to the doctor today and talked about tea. So that's how it's also relevant, kind of. Okay, so I'm going to try to make this quick. The segment of this vlog might be kind of long because I want to talk, first of all, just about the clinic in general because it was fantastic practices, and I want to say it so you know that this exists and you can find it, but also if you like magically happen to be a healthcare provider that sees this, these are ways to affirm your transgender, genderqueer, non-conforming, non-binary human beings that are coming into your practice. So I just want to put that out in the universe. And then I want to talk about a little bit about like what my actual process was. So if you're like, I kind of want to go on hormones, but I don't know where to start, what's it like, what should I expect? Especially if you're non-binary, like I'll go over that. One of the things I'm specifically going to talk about is also birth control because no one talks about it, and that's like a super big question I had. So number one, and I'm gonna try to make this fast, but it won't be. Reasons that this healthcare was amazing were on the phone and on all of their intake paperwork for the clinic and their pharmacy. It asks for your legal name and your preferred name, and it asks for your pronouns, and it asks for your legal sex, but then it also asks about your gender identity, which included both the terms genderqueer and non-binary. I think I ended up checking both because I was just like, what? And it had other. And under, like, if you're transgender, you could say yes, no, or I don't know. So, like, if you were a questioning person, that kind of clued them in. Under sexuality, they had an other option. Like, they were just fantastic as far as the way their paperwork talked about, like, humans and your bodies. And, like, I hate filling out forms that ask if I'm male or female. And the fact that it said legal sex made it, like, 10 or 20% better to say that, I think, for me, personally. I like to be like, legally, it's non-binary. I also get that in a medical setting where you're dealing with specifically trans healthcare, that there are going to be certain things that is relevant to knowing, like, your assigned birth sex and, like, what genitalia you have or had and, like, chromosomes and all that stuff. Like, it matters in some contexts, but not in a lot of others. So it was a good way to word it and get the information they need, in my opinion. But then to make it even more amazing, they all used it. For some reason, the guy that did my intake paperwork thought I told him my preferred name was Austin, and then he called for Austin and no one came up because that's not my name. And then he was kind of like quietly, Carrie? And I went up and he was like, do you use this other name? I was like, no. So, but the fact that he like knew that was a thing and was trying to be mindful of that, even though he didn't even have any paperwork that had a different name on it, like he just paid attention. And then what was the most amazing, well, equally amazing with the paperwork was the fact that they all presented as cisgender, which isn't to say that some of them were not trans or like non-binary, but they all introduced themselves like with their name and their pronouns. And that was so great to not be the person that had to initiate that. A, because as I talk about, I'm not good at remembering. And in that context, I might have been, but probably not, to be completely honest. It's like, oh, it's a normal thing. You're not like outing yourself or othering yourself by having to be the one to bring it up and tell people. Other people are in that position to say like, oh, like even though they might appear female and you would assume the pronouns are she and her, they're telling you that. So that kind of prompts you to be like, oh, I go by this name and this is my set of pronouns. So that was like a really fantastic experience and something I really, if you're a healthcare provider, try to train your staff to do that. And then they actually like use the correct pronouns. There was one, like the person that checked me out was doing a few different things and I don't think she saw like my pronoun anywhere, and she did misgender me to my legal sex once. And then that was it. And I was like, whatever, like I understand how that happened. So the experience itself involved having a really, I mean, I went and they took my vitals like they always do at your doctors, like the nurse checks your blood pressure and your weight, and she took my temperature, that kind of stuff. So that takes a few minutes, and then in my case, I'm pretty certain this person is a nurse practitioner, or the doctor, or whoever you're seeing, the professional will come in. And we talked for like almost like 45 minutes probably. And what we talked about were what kind of changes happen with T, what things are reversible or not. We talked extensively about the fact that I already know the changes I want are not permanent changes, and they're the slowest changes for the most part. And like there are things that I'm indifferent about. Like if my voice changes or doesn't, like I'm not really concerned either way about that. Like I really don't want a beard. I think I forgot to tell her like the moment I start going bald, I'm done if I go on it. Like, but you know, we talked about that extensively, and the fact you can't pick and choose at all, and you can't really predict. Every human is different. You can say like, this is what I've seen most common in people, but that doesn't mean that's how you will react. So it's really about getting like initial levels, trying it, getting other levels, seeing if you're progressing how you want or don't want, and adjusting back and forth. And she talked about mental health background, if I had a support system, just general medical history like any doctor would. We talked very briefly about like coming out experience around that, and like she made a point to say, you could have told me you just discovered you were trans 3 weeks ago and it wouldn't prevent me from prescribing you hormones. Like she's a very informed and knowledgeable person. And she was very, very knowledgeable, but she also like told me about some resources she uses and acknowledged there are areas that she maybe still is like getting educated in, which I think people that are able to do that, like that just to me gives me more trust. Like, hey, you're not going to just make something up for the sake of sounding like you know what you're talking about. You're going to figure it out the right way. She did give me like a bunch of paperwork, and she pulled up some websites and videos. She's like, take a picture, put this in your bookmarks. I want you to read through this. She talked about using like WPATH standards. And I think it's University of California, San Francisco, that has a big like trans health department clinic. She pulled that up, wanted me to like read through stuff there. We talked about risks, like health risks associated with things. And then oh my goodness, I keep looking at the time like, ugh. So, cause I know it's hard to watch long videos. So birth control. So here's the thing. I don't ever hear anyone talk about birth control, and I'm like, I can't be the only person that's like, I might go on T, but also what about birth control? I don't know why no one talks about this. Or maybe like it just depends on who you're like sexually active with, if it's relevant to you, but it's irrelevant to me. So I'm currently on a form of birth control. It's a pill that adds estrogen to my system. Well, she like, I won't prescribe testosterone for this reason. So if it's adding estrogen and then you are injecting or using topical or somehow getting testosterone in your system, they pretty much just counteract each other. So if you have that nullifying effect, you're just not going to get any changes, so what's the point to begin with? But also, you need some type of sex hormone in your body, especially if you're under the ages of like, I hear different things, but 50, 60, at least 50, you need that for lots of health reasons. Sorry, this thing is being weird. Right. My option is to go off of that type of hormonal birth control and pick a new option, which for me I think is going to be an IUD. We talked about a histo, which I'm not opposed to. Like if I could have just walked into a room and had it done and left, that would be fine. But like all the stuff that surrounds surgery, like preparing for it, getting your insurance to try to pay for anything, recovery time, I just like on a practical level am not dealing with that right now. IUD is a good option. First of all, it's practical for another reason, which is that there's a lot of people concerned about access to birth control under this current administration, and like that coverage like from the ACA might go away. So there's kind of just like this other benefit to going on an IUD right now, which is that. But also, that will no longer be adding estrogen. And my doctor, nurse practitioner, whatever her title is, said, she's like, that actually might be enough for you. Like, I might see enough physical changes from being off of that, because I've been on it for almost 20 years. That might actually do what I'm wanting. I don't think it will entirely. I think it'll put me in a better place to get that, and I might see some slightly better like results from working out, but not enough. So I called and made an appointment next week to probably get an IUD from my OBGYN. They do have to do like some preliminary stuff, but it sounds like they should be able to just insert it, and then I can go off the birth control. I think there's like a little overlap period, but maybe not. That's one of the things I have to talk to that person about too. That's fine. So know that if you're going on T, at least my person was like, I'm not going to prescribe it if you're still on any type of medication, birth control that's adding estrogen. Now, she also said what she does is make you sign a piece of paper that says you're not. So like, could you walk in there on that and sign that piece of paper and get a prescription? You could, but that's a really bad idea, because why put yourself at a health risk if you don't have to, is my philosophy there. So, and yeah, you also can use things like condoms and stuff. There are lots of methods, but I like backup plans because I really don't want to be pregnant, for lots of reasons. So that's my plan. That's my method. So I'm doing that in a week. And she had me schedule out, we said 4 weeks, but I wasn't sure if I would get into my OBGYN that quick. So we scheduled about 6 weeks. And if I actually get the IUD next week, I may try to move it up a week or two, to go back. And they do informed consent, which is great. So I'll do the informed consent paperwork, and then she'll do a physical, and as long as there's no red flags, prescribe T. She did also have me work with their pharmacist to see what my insurance covers. Injectables are covered 100%. They can do a prior authorization to see how much, if any, of topical, so like a gel, would be covered. Those are typically more expensive. That is initially what I was leaning heavily toward, because every single person I've heard or read talk about being on low dose uses a gel. And she was like, oh no, you can do that with the injectable, and she prefers it because it's a bit more predictable. Because if you're using the topical, I'm doing this because a lot of people put it on their shoulders, it's fine, and you can even get like the same rate of changes if you want a full dose, but everyone absorbs it at different levels, and so it's a little bit difficult to control it the same way that you can with the injectable is all. That's what she meant by that. But I thought like that was really great too, so I'm set up. She gave me the consent paperwork that I would need to read through, lots of other, like I said, homework, reading material. Had the pharmacist check that out, so we kind of knew what we were looking at when I go back. When I go back, I will tell her like, yeah, I'm gonna do it, or no, but I'll probably still get a physical because I haven't had one for a while. And then that's it. So, and then it'll start. And she did point out, like, she's had people who were on T for 3 weeks and were like, oh, nope, this is not for me, I'm done, and that's fine. She's also had people who are on it for a month or so and then say, I can't believe I went this long without it. It's perfect, exactly what I needed. So it's different for everyone. I don't know what's going to happen in the long run. Yeah, so anyways, that's my update about this. I'm going to go put my laundry in the dryer and do some homework, and then hopefully I'll be back to talk to you about my chest update.